Due largely to the size, expense, and complexity of healthcare today, we often forget that medicine really comes down to stories of individual patients and their individual doctors.
As physicians, we know that there's nothing more gratifying or rewarding than helping our patients get better one patient at a time.
On this week's Health Talk, we'll share a fascinating story about a rare disease, a single doctor's determination, and an individual patient's overwhelming gratitude for successful treatment and outcome.
So stay tuned, we're coming up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. We have a wonderful show for you today. It's an honor to welcome Dr. Seth Sullivan and his patient David Tate. Seth is an attending hospitalist and a clinician educator at Norwalk Hospital, and he cared for Mr. Tate during a fairly recent hospitalization. Welcome to the show.
Yeah, you guys have a great story to tell, sort of the perfect story of a physician uncovering a rare diagnosis. Before we get to the story, just how did you get to know Mr. Tate? And tell a little bit, what's a hospitalist, so people understand your relationship to him in the context of the story.
Sure. A hospitalist will cover for the general medical service in a hospital, and so oftentimes a person's primary care physician is busy in the office. They don't go to the hospital as frequently as they did in the past years, and at this point, because of the increasing complexity of the healthcare system, we have evolved role for generalists in the hospital, which we refer to as a hospitalist. A hospitalist will oversee the care of the patient in the hospital, coordinate amongst different specialties, obviously diagnose and treat diseases. And I met Mr. Tate, to answer your second part of your question, in that role when he was in the emergency room.
So David, you've got a great story because the ending's so good. Tell us a little bit, take us back. You were sick for quite a while and seen lots of different doctors before you finally encountered Seth.
That's right, it wasn't such a great story for a long time.
No,
yes, I'd been healthy as a horse all my life. I didn't have childhood diseases. I never got colds or flu. I never missed a day at work. Felt kind of cheated there. And then a few years ago, it all started to change. I started to get all these odd things that I thought were totally disconnected. I'd never had allergies. Suddenly I started to get allergies. That led to what I was told was late onset asthma. I had a hacking cough that just wouldn't go away, that kept me up at night. I had sinus problems, which led to acute sinusitis again, and even the ENT doctor sort of said he'd never seen it come on that badly that quickly. And I just kind of thought, you know, hey, I'm out of warranty, I'm getting older, the wheels are starting to fall off, that's the way my life is going to be. And then I had a heart attack in my bed at home. I went to Bridgeport, and they diagnosed it was actually help me here.
The spasm.
Spasming, yes. And so my arteries were
clear.
Which is
pretty unusual. I mean, we see it, but it's an unusual way for people to get heart attacks.
Yeah, something called Prinzmetal angina is what I was told it was. So anyway, I got gave me all kinds of meds and sent me home after a couple of nights. And then about 6 weeks, a month later, I was on my way into the city for a business meeting on Metro North, and suddenly I started to feel the chest pain and the jaw and the shoulder, and I thought, whoops, here we go again. Reached for the pills, the little nitroglycerin pills that I'd been told to put under my tongue if I felt this coming on, and of course I'd left them at home that day. So I got off the train in Grand Central and passed out. I woke up in an ambulance en route to Bellevue. And they said the same thing, and in fact they actually saw the spasming happening on screen, changed the meds and sent me home. And when I got back home, the cough was still there. I was still feeling rotten. And I went to see I had a scheduled appointment with my doctor on the following Monday, went in there, and he just told me to get down to Norwalk Hospital straight away. He said I looked awful and I shouldn't be out on the street. And I think I actually met Seth when I was in the ER, right? That's yes, where it started, which that was lucky.
So how long did had all this been going on then? A year and a half?
It was they didn't all hit on day one, but they've been sort of gradually building up all these different things over about a year and a half. Mm-hmm. And then the period from the first heart attack to the second one to being in Norwalk Hospital.
And you've been in the hospital both at Bridgeport Hospital?
Well, I came in here. I came in here, and I was shipped up to Bridgeport.
And then you were in Bellevue as well, in the city.
And Bellevue, I just happened to be in the city when it happened. So that's how I met.
The point I'm trying to get to, you've been seen by lots of doctors.
Oh,
and
yeah.
And your sinus doctor. And were you seeing somebody for your your asthma symptoms
You named
as
the
well?
ologist I was seeing him. Well, I think there was one her in there as well. But yes, I was, and what I was to discover later that I didn't realize at the time is that they were all doing the jobs, but they were all operating in their own silos. They weren't looking at the other set of files from the other silo. And it was only when I was lucky enough to, sounds like a contradiction, lucky enough to come into the hospital here and meet with Seth, that he had the time to look at all those different files and to compare notes and see if there was any connection between them.
Seth, tell us a little bit about what your impressions were when you were first meeting David and looking through what had happened to him and what was going on with him.
Sure. So I received the call from our emergency room, and I heard that Mr. Tate had come in with symptoms that were concerning for cardiac symptoms. I believe he'd had episodes. I'm trying to remember. I don't have the records in front of me. But if I recall correctly, there were issues with maybe passing out and having chest pain. And so we began to collect data from the other hospitals. For non-physicians who might be watching this, a lot of the data is sort of siloed amongst different hospital systems. So data that's obtained at Bridgeport Hospital, for example, is not immediately available to myself.
Even if it's in the computer, to point out we haven't reached that
Even
point.
if it's in
That's
the
an important
computer.
point,
The
'cause
computers
people
don't always
often
communicate
think they
across
do.
health systems.
Yeah, they usually don't, I think.
That's right, that's right. And so despite the internet and all the modern communications technology, we don't always have immediate access to the information. So we immediately began to gather information. We called the various hospitals that Mr. Tate had been to. We called Bellevue. We heard about the fact that he'd had coronary spasms, and that this was thought to be the cause for the underlying symptoms. He'd been placed on a couple of medications to control the spasms. The initial thought was perhaps we needed to adjust those medications or to continue on the same route that had been charted by the cardiologists at the previous two institutions. In reviewing the records, however, we noticed that there were really high levels of a white blood cell type called eosinophils, which are usually involved with parasitic infections, malignancy, asthma, and a host of other diseases. David's were quite high. They're around 30%, 25 to 30%.
And they had been there at the other times, the other doctors.
They had been.
They
had been. We didn't know that immediately. We looked at the eosinophils in the emergency room because we had access to that data. That was the blood draw from the day of presentation or the day that he came into the emergency room. And we thought that was quite odd because the normal value should probably be less than about 5%.
So that was really a key observation, it sounds like. And was it then that you started thinking, maybe these symptoms that David had thought were separate could actually be related?
Yes, that was the prod. As we talked with David further, we found out indeed he'd been healthy his entire life, and all of a sudden he'd had different symptoms arise across different organ systems, and that made me think perhaps there was more to the story than initially been suspected. And so we began the long, tedious process of collecting all the records. It took several days to obtain all the records from all the various specialists, multiple phone calls, and we also had to go through searches of the literature because David's case of Church-Strauss syndrome was actually an unusual presentation. Oftentimes, people with the same disease, because this is a disease that affects the blood vessels, multiple organs can be potentially affected. Classically, that includes the kidney and the skin. David didn't have those issues. He had more issues with his heart and with his lungs. And so it was a little bit of an obscure diagnosis at first, but we were eventually able to collect the data and arrive at the correct diagnosis.
And why do you think, you mentioned that people work in their compartments, and I do think that's an unfortunate reality in modern medicine, is that we all get mile deep knowledge in a fairly narrow silo. Why do you think you recognize it? Why do you think Seth figured this out and it hadn't been figured out before?
I think he had the time, and it was in a location, being in a hospital, where you can have all the files coming together. You're not in your particular ologist office, which says, I only do this. So I think I was lucky to come, not just a hospitalist, but this hospitalist, who had the interest and the time and the inquisitive mind to start looking for connections between those dots, as opposed to my previous couple of trips to hospital had just been this is a heart problem, so here are the pills for the heart problem.
I mean, I always talk to the residents about this. Someone comes in with a diagnosis on their forehead, and oftentimes if it's wrong, nobody ever questions it. It stands there forever. And
Yeah.
so Seth had the, I think what we should be doing as physicians is to question everything, and which you did.
So you were diagnosed with this condition Seth alluded to called Churg-Strauss disease.
Syndrome.
And so if both of you could talk a little bit about that, because I know that's really important to you, David.
It's well, you know, no common cold for me. You know, this is I'm told a 1 in a million situation.
I would say none of us has ever seen a case of, I've never seen a case of Churg-Strauss. Have you, Andrea?
No.
So
And
you've got 3 doctors here, one of them old. And
that's exactly what every time I would say to another doctor, you probably haven't heard of this, but most of the time they say, well, I think I heard about it once in med school or something, but generally speaking, they were not aware of it. And so the subsequent doctor that I hooked up with in Philadelphia at Penn Med, who is probably the world's greatest authority on this particular syndrome, I learned a lot from him, and Seth has had conversations with Dr. Merkel down there as well.
Seth is now a local expert on it. I'm quite sure. But we'll send all of our cases to him.
As he put it to me, he said currently there's maybe 300 cases a year diagnosed in North America, but those are the ones that are diagnosed, that he said that could easily be 3,000 or 300,000 if it were being diagnosed correctly, because of the different, like Lyme disease, I guess, to a degree, it kind of presents itself in so many different ways that it can be very confusing.
The good news for David, right, Seth, is that once the diagnosis was made, there were treatment options which could really help.
There are effective treatment options. David saw a leading expert in this disease, Dr. Merkel, who he mentioned earlier, and was placed on medications that elicited a remission, if I'm not mistaken, or at least 90 to 95% of the symptoms
I've had
got
one
better.
little relapse since then, but generally speaking, it's been very successful.
And that took care of everything: your sinus disease, your cough,
it all
your
fell
lung
away.
disease,
Yeah.
and your heart's
Yeah.
vascular spasm.
Yeah, just as they all came at one time, they all fell away at one time when I was put on a course of prednisone, and then twice yearly. You explain what it is. I don't know.
First it was cyclophosphamide and then rituximab.
Yeah.
So David, you've alluded to this a bit, but maybe you could tell our viewers just a little bit more. We have about 2 minutes left. What did it mean to you to encounter a physician who really heard everything you had been going through, put the pieces together, and helped you get to this right diagnosis?
It was very fortunate. I was very lucky, and you know, I'm not blaming the system that people have this specialties, and they do have to work with people who come to them with those things. They only have so much time to see so many patients, and it's kind of a next please situation in some doctors' offices. So this was, I was lying in a bed, and I had a doctor there who was there to talk to me without having to rush out, and who then would go and research what I told him, as opposed to move straight on to the next patient. I'm sure you were moving straight on to the next patient a lot of the time. but I know Seth burnt the midnight oil looking at this thing, and my wife even was sort of saying, "Hey, Seth called me last night to say he thinks it's so and so." So it was terrific. I was very lucky to run into someone. I think the term hospitalist doesn't really explain the full breadth and value of the job that people like Seth do. But I was if I hadn't bumped into him, I don't know where I'd be today.
Well, to me, this is what a real doctor, real physician is, and
absolutely.
Credit you, Seth, and thank you so much for sharing your tale, because it really is a fabulous one.
Thank you both so much for being on the show. Unfortunately, we've run out of time. We'd like to thank both of our guests, Dr. Seth Sullivan and Mr. David Tate, for joining us on Health Talk today and sharing their remarkable story.
If you have comments or questions for us, please send them to Andrea and me at healthtalk@wchn.org. Andrea and I would love to hear from you.
Thank you so much for watching.